It's a rare condition that most patients have never heard of until the day they're diagnosed. It's a severely debilitating condition that leaves patients struggling to breathe. Idiopathic Pulmonary Fibrosis, IPF, is the rare lung disease which claimed the lives of Hollywood actor Marlon Brando and international daredevil Evel Knievel. If you imagine a stadium full of 100,000 people, between 14 and 43 of them will get it, and it's more common in men than women. Half will die within 2 to 3 years after diagnosis. That means that although it's a relatively rare condition, more people actually die from IPF each year than do women from breast cancer. IPF is classified as idiopathic because the exact cause is unknown. There's a family history in some cases, and there are links with things like chronic viral infections, abnormal acid reflux, smoking, and environmental exposure to industry or farming.
So not all patients with IPF smoke, but the majority of them, 2/3 of them, smoke or have smoked, and it is a strong risk factor. For example, if you belong to a family of IPF, that is a family where several members have had a diagnosis of IPF or interstitial lung disease, fibrotic lung disease, the most important risk that one individual has to develop IPF in this family is to smoke.
But whatever the cause, it triggers a response, which causes scar tissue to build up in the lungs. The pattern of this scarring is very distinctive on high-resolution CT scans, and it's often referred to as honeycombing because it looks like a honeycomb you'd find in a beehive.
Patients with advanced disease often cannot get adequate amounts of oxygen into the bloodstream, and that's the principal reason for them feeling breathless initially when they exert themselves, but as the disease gets more severe, at rest.
The impact on quality of life can be considerable. In most cases, patients have to adjust or limit their physical activity. Many report they have trouble with even basic tasks, like climbing a flight of stairs.
The impact of the disease on the patient's life may come from the symptoms. Obviously, if you have a cough all the time, or if you have a shortness of breath, progressive shortness of breath, you have a strong, important limitation to all exercise and everyday life activities.
The lungs of people with IPF, with the fibrosis present, tend to be much more sensitive to things that normally wouldn't cause cough. So strong smells, cigarette smoke, changing from warm air to cold air, all of these things will often trigger cough in patients with idiopathic pulmonary fibrosis.
Exacerbations are a sudden and rapid worsening of breathlessness, a sort of lung attack. Acute exacerbations are a feature of IPF and are very often unpredictable with no obvious cause.
Acute exacerbation in IPF is an extremely critical event because when a patient gets an acute exacerbation, his likelihood of dying of that acute exacerbation is up to 80%.
IPF is initially misdiagnosed in 50% of cases. This is because its symptoms are so similar to other diseases like COPD, asthma, or heart failure. Correct diagnosis is challenging and requires a series of tests conducted by a multidisciplinary team. However, one key feature of IPF is the distinctive sound doctors can hear when they listen to the lungs with a stethoscope. An IPF-affected lung sounds just like Velcro being slowly pulled apart. Known as rails, these crackles are evident in over 80% of IPF patients and may hold the key to earlier diagnosis.
The sound of Velcro can help the physician to make the diagnosis of IPF because this is an abnormal sound that we hear very early in the course of IPF. So, for example, if the patient at first visit for cough or for some mild shortness of breath has an abnormal lung auscultation with valco rails, this is very suggestive of interstitial lung disease and especially of early IPF.
Through earlier detection, it's hoped that patient outcomes can be improved. For more information, visit soundsofipf.com.